Welcome to our STEM and Health Equity Advocates, our other event on vaccine hesitancy and health equity. My name is Ngozi. I am a junior at Yale, sociology major. And if Amma, you want to introduce yourself as well quickly.
Yeah, hi, I'm Amma Achura. I'm a senior at Yale and I'm an MCDB major and super excited to have this conversation today.
Okay, and we have with us some really cool, amazing, awesome, fabulous speakers. So I can start with the introductions. So first we have Professor Joanna Radin. She is an associate professor of history of medicine and history at Yale. Her research examines the social and technical conditions of possibility for the systems of biomedicine and biotechnology that we live with today. She has a particular interest in global histories of biology, ecology, medicine, technology, and anthropology since 1945, and history of anthropology of life and death, biomedical technology and computing, feminist, indigenous, and queer STS, and science fiction. Yeah, that is Professor Radin. We're happy to have her.
Yeah, so we also have Dr. Julian Watkins. Dr. Watkins is an internist with the NYC Department of Health and Mental Hygiene and a culture of health leader with a history of leadership in clinical medicine and in public health. Dr. Watson is also the creator of the People's Clinic, which is an online public access talk show, which is focused on consciousness raising, community building, and the collective healing necessary to heal and recover from the COVID-19 pandemic, the trauma of the last 4 years, and the effects of centuries of institutional exclusion and oppression.
Yes. And last but not least, we have Dr. Calvin Sun. Dr. Sun is an ER doctor based in New York or New York City. Prior to the pandemic, he would chronicle his international travels as a full-time medical student and resident, traveling to over 190 countries. Since the pandemic, though, he has been integral in disseminating information and documenting his experience for his followers through the pandemic. And he has been recognized for doing one-handed push-ups after receiving his COVID-19 vaccine, and he tries to serve as an educator for the general public related to all things COVID for his followers. So yes, we are happy to have all three of you here with us. And one last thing, I'm going to share a Q&A document that we have in case you want to ask questions through there. You are also welcome to message me or Amma with your questions, and we can bring them up in our conversation.
Okay, so I'm gonna sort of play the role of facilitator in kind of getting a conversation going with Dr. Watkins and Dr. Sun. So originally we were thinking, about questions of about the vaccine, who's taking it, who's not, why and how, and in a conversation that some of the organizers and I and Dr. Watkins were able to have in advance of this event, we started to think about the different language that's been used to describe some of the challenges that are perceived by certain people in facilitating access to the vaccine. And so we've heard language of vaccine there's denialism, and then we heard that term of denialism, which predated COVID, morph into vaccine hesitancy, trying to make sense of from the perspective of people in biomedicine. Why is it that some people are not rushing to take the vaccine while others are doing everything they can to subvert the system of the rollout to get access. Dr. Watkins raised this question of language and talking about, why does it matter how we talk about the vaccine and what it means to use these this different language. And I guess I wanted to to ask you to talk about some of the language that you've been experimenting with using in order to reframe some of the problems or challenges involved in vaccine access.
Yeah, I can take a moment and kind of talk a little bit about the work that I've been doing with narrative change around the vaccines in the New York City Department of Health and Mental Hygiene. As a practicing physician, went to Howard University College of Medicine. Very early in my medical training, I definitely kind of saw that when pieces of myself were reflected in the training, it often was very it was skewed, and it never really did quite captured my experience and the experience that I knew of so many people, like me. And so I knew, like, immediately when the vaccine for COVID was gonna be created, that the narrative was gonna be off. And I knew that they were gonna quote, the Tuskegee study, and just understanding how it's important to look at the way we use our language, and what's behind the words that we're using. And it was just, there's this phrase where, like, vaccine hesitancy, and the common thing in medical practice is, you all moving away from pathologizing people and actually trying to, like, use person first language. So the term vaccine hesitant was already kind of didn't really ring true. But then there was, like, a deeper kind of understanding where, like, it's prescribing that these are people who are hesitant, there's something wrong with them, that they don't understand, or they don't get what, this thing, vaccines, that we're trying to give them, or that we've created for them. And just understanding that it's actually an expression of a lack of confidence. And these communities are people who have a lack of confidence in a system that has never proven itself to be trustworthy, or proven to actually show caring, and grace towards these communities. And that really takes that focus off of these communities as being aggrieved, and, not getting over, the Tuskegee experiment, for example, which started in the 1930s. And it really puts that focus back on the healthcare systems, these systems and the government that never really earned their trust, and in many instances is, like, actively harming these communities, and committing, like, violence on a broad scale. So it was kind of like correcting that narrative, because it is really important.
Yeah, that's really significant. And I guess I want to pose a similar question to Dr. Sun. It sounds like you had already a significant kind of following online, and had a really quick pivot to recognizing that there was a need for a certain kind of information as COVID, beset New York City. And I wonder if you could talk a little bit about your own experiences and what needs you perceived from your vantage point.
Thank you, Professor Adam. And it's good to be with Dr. Watkins as well. This panel, thank you for having me. It really depends on the audience that I'm speaking to when it comes to talking about the vaccine. This morning, I spoke with the Women's Prisoner Association, where their questioning were very different from the day-to-day patients that come to see me in the emergency room, and then the huge different kind of patient populations at the various urgent care centers that I work at on my days off. And depending on the neighborhoods and the communities that they're representing, if they're underserved or privileged, I have to adjust my vocabulary and, if you will, code switch in order to meet people where they are for this purpose, ultimately to get as many people vaccinated as possible. But also the purpose is to make them want it rather than do it because we told them to. And when I speak for, when I communicate with, people who feel they've been let down by the system, you have to meet them where they are and understand that that's extremely understandable, if not warranted. Most of it is due to an emotional argument. And in order to get to them, you have to present your argument, if that word's the correct one, arguing, but your debate in an emotional manner. There's no amount of logic that's going to reach people who have been convinced emotionally that the entire system has let them down. So why should they participate in something that has been, for generations, have only exploited them? And they only come to us for something that they want something done specific in that moment and really don't want to consider anything else. I have not a lot now, but more than enough patients who come in for, my finger hurts, I want you to fix it, but I'm not going to get the vaccine when the issue it brings up, because almost everything is COVID related. So you have to understand why they feel that way. And if it's something that's totally understandable, because I remember I was studying to be a medical student, and I'm like, I don't want to be part of this system. What am I doing? I mean, maybe this whole thing is a bust, but also it's incumbent upon me with someone with privilege to be the communicator and translate something emotional in a way that people can understand the person that they're facing, who is a clinician, understand where they're coming from and how to guide them, carry them to a place where you have a mutual understanding and be on the same page. For example, I wished I lived in a world where we didn't have to talk about a vaccine, because we didn't have to let a pandemic get to this get to this point in our lives where we have to even debate a vaccine in the first place. Like, we shouldn't have been in this position. But now we are, and we're stuck in a rock and a hard place. We have to choose between something that's been emergency authorized in a short amount of time that feels rushed, if you will, versus a virus that's killing all of us, especially communities of color. And because of that, they're afraid, they act on that fear, and then they make decisions that's based on their fear that may not be logical. So this is a long conversation that we just started, but starting with the emotional argument and connecting them emotionally and getting to empathize, you then become their guide, which I think that's why I signed up to be a doctor in the first place, is not necessarily to fix things or save people's lives. I mean, that's like a cherry on top, but rather to be a guide for people who are going through something they don't quite understand, and helping them understand it in their language to a place that both of you can be on the same page.
Yeah, that's really eloquent. And that idea of being a guide, and also thinking the relationship between sort of emotion and logic. I think sometimes there's this sense on behalf of certain clinicians that there's an irrationality to not having confidence about the vaccine. And I was a part of a listening session with members of Yale's own infectious disease program, where initially it was cast as a problem of mistrust. And what really emerged, and what the clinicians, I think, were taken aback by, was exactly as you say, Dr. Sun. It's there's fear there. And I wondered if we could talk a little bit more about fear. Dr. Watkins mentioned the Tuskegee study, which, in case those of you listening aren't familiar, was a very exploitative and violent study where people were allowed to have Black men were allowed to have progressive syphilis, so that public health officials and doctors could study the natural history or progression of the disease, even when there was treatment available. And when this came out, it obviously was really destructive to already not great relationships between Black Americans and the medical system. But what came out in this listening session is that this narrative of mistrust, that's linked to this study that happened, as Dr. Watkins said, more than 50 years ago, covers up the fact that there are still legitimate reasons that people feel like they're not being guided in the present, or people feel dehumanized by their experiences with medicine. And so I wanted to invite you both to talk a little bit more about some of your own lived experiences as clinicians with encountering fear, and talking about fear as you have seen it expressed in your patients' language, that can help us get an understanding of what might actually be quite logical within someone's worldview and someone's experiences.
Yeah, I mean, I would say in many instances, it's a very logical reaction, and it's protective in many ways to have a sense of fear, or to not trust some of these government institutions. As a Black person living in this country, I think twice before I would call the cops, you know? Or there's a lot of times where there's a lot of single Black mothers, think twice before taking their kid to the emergency room, you know? Or like, you think twice about putting your kid in a school that's predominantly, white. just knowing the way that over and over again, Black bodies are policed in this way. And it's the same thing in medicine. Like I've seen it where people go in looking for safety and healing, and they meet a judge and jury. And you see people judge them the moment they step in there, and people don't treat I mean, there's study after study that physicians don't treat Black people's pain. They have this antiquated racist belief that Black people don't experience pain on the same level, and it's really, really deep. And so I would say in many instances, folks can look from the outside in and say that it's illogical, but I think it's perfectly rational for many of these people to feel this way. You look at how the COVID crisis happened, and I talk to hundreds of people a week in community conversations with the health department, and people are just like, why does COVID matter so much when people are dying from climate change? Why does COVID matter so much when I live in the Bronx and 80% of the people who are getting HIV in the Bronx are Black and brown, and y'all can't have a vaccine for that? And so I think it's understanding that when we look at these communities, we have to understand the whole picture. We have to see these whole communities and understand that people don't live these single issue lives. COVID is a big issue, but that's still not the single issue, because there's still people who can't put food on the table. There's still people who can't find a job. And so it's just understanding that sometimes those fears are warranted and those fears are protective. And it's trying to get deeper, having that deeper conversation with a better understanding that, like, just because it seems irrational to me, it's been protective, and that may have been the thing that has kept their family or community alive for many generations.
Yeah, Dr. Sun, would you like to add?
I agree wholeheartedly. It's the fact that everything is connected. I always try to connect a concern in the larger context. I mean, even as in patient care, one organ system is actually connected to many other organ systems that work in a cycle, and helping patients understand better that it's not just one thing that they're really worried about. There's a whole circumstance. It's not about what the problem is. It's actually what I teach my residents. Why are they there? How do we make sure they never come back to the emergency room again? You fixed the hypoglycemia by getting their sugar to a certain number. You protected a number, but what about the patient? Why was their sugar low? What brought them in there? Was it something that got them, whether it was not having enough prescription medicine, or they were actually intentionally trying to harm themselves? If you don't really ask, you don't really look, you don't really find it. And then the same goes with, the concerns about the vaccine is that it's not a single issue. It's connected in a larger circumstance, that people feel that they are being pushed by an institution that has completely let them down, exploited them, have used their bodies for research without any compensation. Henrietta Lacks, the whole OBGYN specialty, and the fact is, like, why should I even participate? And that's goes to the issue with our clinical trials for the vaccine, where there's not enough communities of color represented. So people read about this and they're like, why do I want to participate in a vaccine? They may not have external validity to my community. If I'm in my communities of color, we're not participating in the vaccine. Well, it's like the chicken and an egg argument. People didn't want to participate in your clinical trial because the last time you had a clinical trial that went in the news, you took 50 years to apologize for. Why should you want to participate? And as a result, communities of non-color, white communities are participating in these clinical trials, so they're more likely to, benefit because they're trusted data more, and another community gets left out, and it's this endless negative feedback cycle that allows the status quo to maintain their power and win, because we're always constantly fighting against each other, not really truly, breaking that cycle. What will it take to break that cycle? People who are going to step in willingly. I actually this morning I used the example of Georgia. It's in politics. It's all connected. People didn't want to vote because they felt that the system was going to let them down, and there's no point in voting. There's not going to have representative power. And then Stacey Abrams was like, you know what? I lost the election. It let me down, and I'm still going to participate, and I'm still going to, do voter registration and, flip Georgia blue. And it happened. And of course, there's going to be a backlash, and then people can get let down. But I think it's a good example that this is the fight that we need to do, where we need to break that endless cycle where the status quo actually benefits from people who are certain groups of people who are reluctant to get the vaccine, because I honestly believe that nobody's safe until all of us are safe. And this is where even we're going to transition to the part where there are certain developing countries in the world that will never get the vaccine for years. And people don't care about that, but they don't even realize that if you don't vaccinate the developing world of the global South, and if you only vaccinate Americans, if you will, the virus is going to go there, mutate, and then make us repeat this all over again. But people don't think that far ahead. And there's like a proverb I always say, you know, if you want to go fast, go alone. We're trying to get fast. We're trying to go back to normal, whatever that is. I mean, normal is what brought us here. So I don't know why people are trying to get fast to normal. But if you want to go far, if you want to go fast, go alone. If you want to go far, go together. And nobody really wants to go together because it's not fast enough.
Yeah, I mean, so much in what each of you has just said. And I'm excited to see some of the alums from my History of Global Health class last semester on this call. And one of the questions that we found ourselves asking as the semester went on, you know, we heard a lot of narratives before we had a vaccine, right? We got vaccines sort of towards the end of the class, but, you know, what won't a vaccine fix? And when you define COVID in terms of a vaccine, you know, we heard this from administrators at Yale, from, you know, different kinds of leaders. If you see COVID as a problem in need of a vaccine and that COVID is solved when the vaccine arrives, what aren't you paying attention to? And I'm curious to hear each of you speak just even a little bit more about the ways in which you know, you see the focus on the vaccine and the issues that have come around with issues of access, you know, being connected to other dimensions of public health and these enduring issues that you both touched on.
I mean, this country has a long tradition of kind of focusing on things, you know, focusing on commodities. And, you know, the vaccine is the newest precious commodity that, you know, is the thing that we can all turn our focus on. And the country does a really bad job at doing the hard work. You know, we find the one thing and we say, yep, we fixed it, you know, wash our hands of it and move on. You know, you go back a few years, look at the civil rights movement, for example. All of those gains that were made were all begrudgingly, but you look at the way the narrative has changed, or, you know, the narrative, like racism has ended. There is no structural racism, and it's just, and like, okay. And then you look at like women's rights, you look at voting rights, you know, as Dr. Sun said earlier, like I grew up in Georgia. Like I was very surprised that that happened. But then but then you look at the backlash to this election, and you see, you know, in the recent months, like all this legislation built to suppress voters even more. And like these same people who are doing these, you know, these systemic racist things are the same people who are saying that racism doesn't exist. And it's because of these narratives, because of this history of this country. And I think it's all based on lies, and it's all based on people not really understanding like the true complete history of this place, right? Like we live in America, and there's people who are so grounded in this story, in this narrative, their personal identities and everything about them is grounded in this thing. And it's like they can't, they're so concrete in their thinking around, this is the number one nation, this is a moral nation, this is a Christian nation. And then they can't imagine a reality where they aren't the good guys, that this genocide and this trafficking of millions of people that happened, they can't accept that that is also part of the story, because they're so grounded and concrete in their thinking. And so things like this, like they can't admit that systemic racism exists. They can't admit that all these other issues that are affecting people and that have contributed to this virus and that have caused it to kill people in disproportionate rates, they can't admit any of it, because it gets at that core lie that so many people, some of our fellow countrymen have accepted and have based so much on their identities on, because I think there's like they don't have anything else. And so they'll sit around and they'll say these things and like, it's the vaccine for me. And it's like, there are some bigger issues going on here. And we know that there are things that got us out of the first wave in New York City, you know, when over 20 plus, you know, 1,000 people died in our city, and we got out of it literally through social distancing, wearing masks, washing our hands. But people, they can't admit that that is the thing. And so the conversation on the vaccine, we can't put so much into it, because it's never going to be enough. I mean, what are we going to just get vaccinated every 4 months to meet the new variant And it's like, it's never going to be enough. And until enough people kind of open up their eyes and face what the uprising of the summer was about and actually address that pandemic of exclusion and racism and these messed up hierarchical systems, we're going to be stuck in this. It's going to be like Russian Doll for my Netflix fans. Like, we're going to just keep dying over and over and over and looking at it and like, how can we get out of this? Like, until we do the hard work and look at what's going on, how do we get out of it?
And I would just add to that, and America has often been a nation, that's very technocentric, that they look for the techno fix. And if we look at who's funding, a lot of public health, I think one of the reasons why someone like Bill Gates gets, sort of slandered is that, on the one hand, yes, he's a very generous philanthropist. On the other hand, he's someone who accrued an incredible amount of personal fortune and then gets to determine what counts as a solution, and also what counts as a problem. And I was thinking too about what Dr. Sun was saying about, this sort of global picture. And I think connected to that, one thing that really jumped out to me in the fall, in particular, teaching about global health, was the narrative breaking down about the United States as a developed country, and sort of seeing the ways in which other nations were not looking to the U.S. For leadership. And I'm curious, just, Dr. Sun is someone who has traveled extensively. What's your sense of, how health care and medicine is looking from other vantage points, and what we might gain from thinking in a more global way about maybe provincializing some of the narratives that the United States tells itself?
So it's like a tale of two cities, or the diametrically opposed concept, or is it, what do you want to call it, cognitive dissonance? It really depends on who the medicine is serving. I like to think of it as eminent domain and expansion and gentrification. Is it working against the community, or is it working for a community? It's not about what you do, but how you do it. And unfortunately, the viewpoint of how the United States healthcare system, and it doesn't take someone to travel to realize it's completely broken. It has been broken for decades or generations, and all COVID did was just make it more clear to everyone else how broken it was, but we saw it coming. So yeah, you travel, and the concept is that Americans have the best technology capable of treating the weirdest and most undiagnosable diseases. If you were to have something that no one's ever heard about, you look to the United States for the innovation. But at the same time, who is that innovation serving? And it's usually for the people who have the resources to can afford it, who have access to it. And that's what we have failed the most at. And the other side of the cognitive dissonance spectrum is there's no access. The healthcare system, in terms of its insurance reliance on insurance companies, is not considered reliable, and it's a joke compared to the rest of the Western world. And this is in view of, developing nations as well, that the United States has the best of something and the worst of something else. And I think we're very polarizing with that regard. And, the last occupant of the White House, made that narrative too, that he was the best at some things, but really he was the worst at a lot of things. But people believed in it because it's about how you sell it. And we're very good at selling it. And I think that's the narrative of capitalism, and that, you have a lot of money, you throw a lot of money at it, and you profit off of conflict. You need conflict in order to create innovation and profits. And if everything was hunky-dory and everything was working well, everyone had the most ideal body image and we didn't have any issues, right? Everything would be going out of business. And unfortunately, that's not how our capitalism structure is relied upon. We need conflict. We need people to not have access to things. We need people to desire things that they may not even need. And we need people to, yearn for things that they actually do need, but they should have been provided that for free of charge, and by the government, but not. And as a result, that drives that surplus, that demand. The irony I even see with the vaccines. Originally, people didn't really want the vaccines, by and large, in among my patient population. And all of a sudden, because the supply ran out, it ran like a Supreme brand, like people lining around the block for like Supreme labels and kit. I don't understand how it works, but they make a lot of money by saying there's not enough supply. And all of a sudden, everyone knew that didn't want it.
Creating artificial scarcity.
Exactly. They wanted it. They wanted to be part of this cool club getting vaccinated, even though that these are the same people that came to ER and it's like, I'll never get it. But now they're like, do you have it? Do you have it? It blows my mind that the emotions that get involved, but I realize it's really capitalism at work. So, and that's, I think, what the United States does in terms of the viewpoint of the world, is that somehow it gets away with it. I can't quite put a finger on it. If I do, I'll write. But
yeah, so I'm interested in this question of getting away with it. I think you're both speaking, really powerfully about some of the ways of reframing rather than a kind of victim blaming sort of narrative that, oh, well, people don't trust us, and if they just trusted us, we would do everything. And you've laid out a lot of compelling reasons why that is not deserving. I want to ask a question about how you relate to your colleagues, to fellow healthcare providers that maybe haven't done the work of educating themselves about American history, about some of these kinds of issues. I think there's some systemic issues in our education system and even in the way healthcare providers are trained. I say as someone who does work in that area, that at a very early age, often people are kind of tracked off saying, oh, you want to be, you're a math science person, you're going to go to medicine. And there's this fragmentation, and what happens, and I see happen, is there are a lot of clinicians with good intentions, but don't have the language to understand or make sense of the problems. And, I imagine that the work that you're doing is not only connecting with, communities that are seeking your guidance, but, what kind of horizontal sort of work do you find yourselves doing in talking with colleagues that are maybe perpetuating these unproductive narratives, or are, disdaining or negative towards people that are not just doing what they think they should be doing? How do you deal with those kinds of power dynamics? And you're both, I recognize, early on in your careers. So the work that you're doing here, I just want to call out for the students that are listening, like, it takes a lot of courage, to stand up to this establishment, if you're outside of it, but sometimes it takes just as much courage, if not more, to stand up to the establishment when you're inside it.
Yeah. I mean, it's a daily struggle. Oh, it's a daily, not struggle, because it's not, it doesn't feel like it. It's heavy, but it's not too heavy, right? I think it's understanding that at the end of the day, it's coming from it's an internal drive to move through the world with integrity, and to move through the world and be fully committed and understand and truly believe that Black people deserve peace, love, and good health. And when I show up with my whole self. And I show up and I speak and I say what I have to say. I stand up and I'll speak out against the injustice that we see. I'll question the things that people aren't questioning. I'll raise concerns that people will feel like is like, doesn't matter, because I know that there are people out there, like in my very short time on this world, I've met a lot of people, and just understanding that if we're not showing up to our work thinking about poor and working class and communities of color as the New York City Department of Health and Mental Hygiene, then what are we doing? And I lead with that, and no one can even, what can they say if you're like, these are the people we actually have to look out for, so it's like leading with, like, moving with integrity and helping people understand and see, with some grace, where there can be improvements, and then it's doing the work. And so, I started this group within the health department called the Immunization Justice Work Group, basically to teach. We created content to educate staff, created content from staff to focus on the fact that at the beginning of the vaccine efforts, the Department of Health was basically, of all the city agencies, we were right in the middle on the range of staff that would accept the vaccine or not. So we clearly it was shameful to see that people working for the New York City Department of Health and Mental Hygiene weren't accepting the vaccine because they didn't trust it. And the question, and I raised this question and said, it's shameful. And it's all on us as these leaders in the agency that we did nothing to reach out to these folks. These are New Yorkers. These are people in communities. These are people of color. You know, our agency is over 50% Black, you know, but those Black people are not in these high positions of power. I'm one of a very few Black doctors, you know, in that agency. And I think, and it's just calling out the things and doing and like speaking with integrity, and just since the uprising in the summer, speaking to that, speaking out in town halls and acknowledging that it all matters, you know, that COVID is a Black Matter issue, that it's a Black Lives Matter issue, you know, that all of these issues that we are facing and working towards have a social context. It's connecting us and, you know, moving with integrity. That's what I.
Yeah, live a virtuous life. I mean, I agree with that. Live a virtuous life. What are you doing now that's making a difference? Everything you're doing, it's not about what you're doing, but why are you doing it? Is it making an impact in the moment? When I interact with people horizontally and within my community, I think it represents not just them, but also like a lot of my patients, especially those who are privileged and should know better. And there's this pandemic of entitlement that I feel have been wrestling with ever since March. It's not just a virus, but entitlement is what like my mortal enemy. When people feel that they're entitled to not wear masks, that they had a way of life that was great, but now the virus has just inconvenienced them. They have to stay home, so they choose not to, or they want to go to Florida or a boat party in Miami specifically, and then spread it during the explosion of the variants because they're entitled to that, and they come back and they get really upset that things aren't going their way. I see that that's the same argument when it comes to vaccines. Why should I put that in my body? I'm entitled to do whatever I want. These are people who, again, goes back to, they don't want to be team players. They're very selfish. And I think that's why I'm grateful to be in New York City. And that we share, there's millions and millions of us who share a small space. So we know how to, work together. I mean, we've also been pummeled to death and sucker punched over and over and over again. So we know how to bounce back from things like 9/11, the financial crisis, Hurricane Sandy, like you name it, we've been through it. And then when I travel across the country, I see that no one else really lives like New Yorkers. I mean, everyone has their own white picket house in their own house and their own family. And it's my family comes first and fuck everyone else. I don't want to take this vaccine. I don't want to help anyone else. So that, I think that kind of attitude, it becomes pervasive in that, it just ingrains that sense of entitlement. And especially if they're prideful, and in that pride, it's just derived from a sense of fear. And that's what we have to understand where they're coming from. Even the people or my colleagues who refuse to learn about the vaccine, they become lazy with this entitlement that they think they know better. They know everything that needs to know, that at the end of their careers, that they don't want to be lifelong students. And they think they just go by their element of, resting on their laurels, not having to learn anything more. And I think that comes from probably a position of fear and an imposter syndrome where they don't want to look vulnerable. Patients don't want to feel that way. It's a sense of pride that people don't want to be pitied. And among my colleagues who don't want to learn about the vaccine, they also don't want to make they don't want to make a mistake. And that's why I always ask them, like, are you trying to protect yourself or the patient? When you're reluctant to, do certain things or do too much or overtest, or let alone, promote a vaccine because you're too scared of something bad that might happen, when you should know better and do your work. So I have to channel some of my Audre Lorde and say, like, when it comes to educating our colleagues, are they worth it? Are they willing to learn? You can only help the people that want to be helped. So I have to ask myself, are they worth it? Is it a battle worth fighting for? Because you can't pour from an empty cup. I have only so much energy to give to the people that deserve it. I want to be able to give it to everyone. I mean, live a virtuous life. I mean, Dr. Watkins says, like, we have to go in with integrity and try to take care of as many people as possible. But also, like, I'm exhausted. I mean, I've had friends and family that we've all had it. And in, this past year, like, now it's also incumbent upon me to, like, educate everyone who's too lazy or too entitled to educate themselves or too prideful. I can't really satisfy that pride, but if they're willing to reach out and want to learn and they want to help and they show their vulnerability, and I feel they're worth it, then of course I'm happy to. I have to meet them where they are and have to understand whatever they're feeling. I have to reframe it. And I think the last thing I have to end on is that, in the COVID, people ask me interviews. Are you afraid of going to work? Are you afraid of going to work on, whatever it is? And then my answer is like, of course I'm afraid. I'm per diem. I don't have to go to work. In fact, I chose to be per diem, full-time per diem, so I don't never have to work if I don't want to. I choose and whenever I wear to work, so that a time of pandemic comes around, I can just sit on my ass and protect myself and my family. That's what I thought I was going to do, but then ended up going in over and over and over again, because this fear became this fuel that I was just like, I have to go in, right? It's not about it, the fear is there, but the fear is the fuel that makes me go in, where sometimes it makes someone else not go in. Fear is just a feeling. Pride is just the feeling, entitlement or whatever. It's not about the feeling, it's about the meaning you associate in the action that you derive from that feeling. I am aware of something X that I could be better. How do I use it to my advantage so that I can help other people and help myself? And that's not the problem, is that people are feeling certain things. It's about what they're doing with it and what their habits are. And we're just up to us to change those habits of society.
I know that there's a question from the audience, but I really just want to underscore what's coming up here. The way that fear, does keep sort of emerging as maybe a place where it would be productive to be paying attention to. Where is fear? And then you start seeing this really much richer landscape of the reasons why people do and don't take action. And so I think that is something that's really fascinating. And I would say it's not just an emotion, but fear, we shouldn't underestimate the political power of fear, the way that fear can be harnessed in the service of hate, but the way that fear may also be a gateway to, as you say, vulnerability, or a mutual sense of, confronting what we don't understand. And I'm also glad to hear you kind of mention your own, emotional fortitude, because we should be aware, before this pandemic, there was already crises of burnout in the healthcare profession among residents. And, what are thinking about some of these strategies and ways that it's necessary for each of you as healthcare providers, as leaders in your community, to fortify yourself. So before we just go to that question, I just want to ask you each to say something about what you're doing, because this is a long haul, right? This is about really being able to endure and keep getting out there. So just asking you, what are you doing, and what advice do you have for some of the students that are listening, who are, I know, super engaged and active, about how do you balance, how do you not, how do you keep your cup full, as Dr. Sun said?
I mean, for me, it's all about love. I mean, a lot of times in academia and medicine, people like they shudder at the word. Um, but I think when you truly get down to it, it's about a love for community, and a love for your people, and a love for the broader community, and a love of people in general. And when I felt fear, when I was worried sick, it was out of, because I love people. I want people to do well. When I'm anger, when I'm angry rather, when I feel anger, it's because I hate to see oppression. I hate to see people be taken advantage of. And I hate to see what is happening to these people who I have a deep love for. And so it's it's this balance of where is your where is your strength coming from? And knowing that it's a choice, that love and hope and peace and harmony is out there and it's available to us. We just have to choose it. We have to find it where it is in our lives. We have to nurture it when we find it. We have to read about it. We have to study it. We have to see how its power can be harnessed, how it can manifest. We have to take the time to really focus on this thing, because if you think about a love ethic and what it's done for generations of people, especially like, I come from African American and also Central American background. Like, my people have been through the wire, like, for hundreds of years, but it's through that love ethic for the people, and for what they believed was their God, that so much beauty came out of some of the darkest things, like all the musical talent, all, like, so much has come out of a love for people in some of the darkest times. And it was during the pandemic where it worked for me. Like it snapped. I was like, oh, it really is about that. And when you choose it, it's like one of the best decisions I made. And so like choosing love and really wanting to like look into that deeper and use that to be the thing that guides me through these times, because it's worked before and like it's working again so far, you know?
That was my exact answer when people ask me, why do you go in if you're afraid? And I actually said, isn't that what love is? Like love is like a temporary form of insanity. In my opinion, the definition is that you know it's maybe not the right thing to do logically, but you do it anyway out of this unexplainable emotional whatever energy that is out there, whether you're spiritual, religious, or just believe in yourself. There's this thing that pulls you to do something even if it overrides any sense of self-preservation, and I think that's love. And that's what made me go in every day. But it didn't make sense in the moment. I was just going in because my colleague got sick, or somebody got COVID, or nurses were scared and wanted me to come do a second shift to take on all the patients that were coming in. I was like, you know what, I want to go to bed, but let's do it. Let's go in. And then it didn't make sense in the moment. It just felt like I had to do it. It was just a gut thing. I'm an emotional, like I trust my gut. But it didn't really make sense to me until I looked back and try to really understand what made me go in over and over again. And the best answer I could give people was this concept of love. And that's how I choose to worship love. That's how I choose to define love. I mean, many other people have different definitions, but I think I actually lived it. So Dr. Watkins says, like, it's from the hardest of moments that you find a definition, that you redefine something, that you reinforce certain beliefs. And that's how you harden, a sword, if you will, from just from a lot of stress. But for the people who are looking for balance, I like to also offer the idea that burnout is a lot of things, but I think what we are going through is something called moral injury. We've been let down, we've been exploited, we're exploited, we've been treated as commodities, and we're probably going to have a backlash against healthcare workers. We're going to get thrown under the bus and be blamed that we complain about having too few ventilators and now we have too many, or something bad is going to happen with the vaccine and it's going to be like we're just pushing it too fast, or whatever it is. And I be incumbent upon you that that's going to be inevitable when the society is going to choose a scapegoat, and I'm afraid it's going to be us, and that's just going to be a continuation of the moral injury. So I beseech those who are listening, the colleagues out there, to do one non-medical thing, or not like something that's out of your scope of practice, something that takes you away. For me, that was traveling. I can't do it now in COVID, but like up until COVID, every 3 to 4 weeks, I would just get away from it all. Just literally and physically. And people are like, oh, did you travel for like medicine or like help people and, do medical missions? No, I just traveled to get away from everything and just to see things from a different point of view. I'll take the cheapest flights I can get, $50, to leave the country on some Norwegian air shuttle to where I was, so I can just get a perspective of the big picture, looking at the painting from far away rather than getting up and knee deep into it. Then during COVID, when I couldn't travel, when Black Lives Matter protests came out in the streets, I just, contacted my friends who worked as street medics. And I'm like, I used to do this. Can I get out there? And they're like, well, let's come on out. We need you in City Hall. So and I went, and it was completely opposite of everything I'd done in the emergency room. And I mean, it wasn't completely out of the spectrum of a medicine, if you will, but it really recharged me in a way that I never expected it would. And I just went for it. And I think that was something that I needed to do that took me away from every day in the emergency room. So identify that thing for you right now and make that a habit, so that anytime you feel that sense of that burnout or it's very hard to find love, you automatically do it like it's brushing your teeth. I mean, I hate going to the gym. I hate brushing my teeth. It's so annoying, but I'm glad it's a habit, because now looking back, I still have my teeth and I'm very healthy. So it's just make it like that. It's all about habits.
Rosie, you want to ask the question?
Wow. I'm still processing everything that's been said for the past hour. I'm gonna have to take a second after. All very informative, very insightful. Both of you. I wish we could talk for hours and hours. But I know people have things to do. So one person sent a question. She asked, how do we address the issue of scientific communication of vaccine efficacy, especially in light of claims that vulnerable communities will receive the Johnson & Johnson vaccine over the Moderna or Pfizer vaccine. Just reiterating, how would we address people's concerns relating to that? If people think like, oh, 1 dose versus 2 doses is better, or like Moderna and Pfizer came out before, just things like that. How have you addressed that, or like how can the scientific community or doctors be better at addressing that? That's for anyone.
I mean, that's a lot of the work that we're doing is around like this narrative and how you talk about the vaccine. I think it's about being real. Like, don't hide it. Don't like double down into this medical jargon. It's like, talk about it. And I think there are some really important features of the vaccines that matter, and I think we should be talking about them. Johnson and Johnson, it's a lot more portable, and so in New York City, we're using it to take it out to folks who are homebound, folks who cannot leave their homes, their apartments, to get vaccinated. They're using Johnson and Johnson to reach folks who don't have homes, so that if they aren't at a shelter in the next 28 days, they just get the 1 dose. There's other alternatives too, and I think it's just the bigger picture is understanding that these vaccines do things really well, right? We don't know about prevention of transmission, but we know that they are really effective at preventing death. They're good at preventing hospitalization. They're good at preventing severe illness, which are 3 of the most significant patient outcomes that I can imagine right now. And so it's just like finding the way to package a thing and not get so bogged down in this versus that, efficacy versus the moderate to severe. It's like it does some things really well, and then just really driving home that message about how vaccines are the public health intervention, the thing, like one of the most significant things that humanity has done, and that's how we've gotten out of prior pandemics. So it's about how you package it.
Yeah, it's how you sell it. You got to meet them where they are. Debating on the crowd, I mean, people usually like the analogy used. It's like Coke versus Pepsi, that they're both exactly the same. You might like Coke better, you might like Pepsi, but they both do the same thing. They're carbonated beverages that are great on a hot summer day. If you're not thirsty, if you don't have COVID, I mean, if there were no COVID in the world, then you don't need to have either. But there's COVID everywhere. It's a hot summer day. Choose either. They both prevent hospitalizations and death among all 3 of them, including Johnson & Johnson, 100%. And that's all that matters, so that we don't overwhelm our hospital systems. I mean, people even complain, why are smokers prioritized before teachers? I'm like, totally get it. You have to understand their frustrations with that. But if a smoker were to get COVID and be unvaccinated, they're more likely to overrun my ERs than a teacher who's unvaccinated with COVID. It's sucky, but that's the ethics that's been involved. And you have to make them understand even the whole 66% of Johnson & Johnson. It was done, the trials were done during the explosion of the variants, whereas Pfizer and Moderna, 100 or 95% number was done before the variants. It's not fair. But guess what? They're all 100% in preventing severe symptoms and death and hospitalizations. So why does it matter if you get a little bit sick versus a lot of sick? If it does, then you're brand shopping and you're exercising privilege. And if you say depends on your audience, but if you say it in a nice way or that kind of way, it gets them. The emotion like, I don't want to be that asshole. I don't want to be that asshole. Great. Don't be an asshole. Get either.
Fair enough. That's at least my version of the question. So yeah, I know Amma had another question.
Yeah, so I think that this has been super great as well. Like speaking to what Ngozi said, I've been very much like learning so much today. And I know that some people have been kind of wondering about like things that are more hopeful or things that like, what can we do? Or like, what can, you know what I mean? As people who like want to be future healthcare professionals or future like educators, future people who just want to like make the situation better, like what can be done? Because we do understand there's so many difficulties. So, I mean, if you could speak to something about something about hope in this moment.
Can I just say quickly before responding?
Go ahead.
Listening, I really think that SHEA needs to do a love-in. Like we need to we're hearing about love, but like we need to like learn how to love. Like maybe it would be helpful to do something like that. So just before that moment passes, I just listening to what, Dr. Watkins, Dr. Sun said, I was feeling so inspired, but realizing too, like, that's not a skill set. Not that love should be reduced to a skill set, but, not something that is comes easy to people that are in elite places. And I think that maybe we need some like remedial, like love tutorial, and that would be really cool to think about doing together.
The question was hope. Oh yeah, hope. I'm hopeful in this moment because you think of, I was working in HIV before in STI clinics in the city, and understanding how much the HIV pandemic changed so much about our lives today in ways that a lot of folks probably don't even understand. And I think that, and I'm hopeful that seeing the response, seeing what happened, what happened in May last year, and how the outcry, seeing the focus and the discussions around equity, the discussions around how we can be better at the work that we do, how we can reimagine all of these things, like introducing the concept of defunding the police, a concept that we defund education, we defund public health, we defund all these things, but somehow, so the fact that these certain things are being discussed now, I'm hopeful, because I feel like we're like, humanity has been through ages of enlightenment, and I think that we are on the cusp of something that I think is bigger than any of us, anyone on this call for sure, has probably experienced in our lifetimes, about moving the culture forward and having a better understanding and mindfulness, and like really having these hard conversations and accepting some of the hard truths, which is the necessary part of this like growth that we need, for this cultural shift. And so that's one of the biggest pieces of hope that I cling to. And I think just being part of that, being like alive and working and in the field, on the front lines, having some type of platform to kind of add a voice to this discourse, those things bring me hope. Beyond just seeing what I've seen around this city, for mutual aid and people being activated and helping out neighbors, and people really like coming together and rallying and just really moving forward the cause for change. Like there's hope out there. So you may have to look a little harder because there's so much pain and loss, but there's definitely hope out there if you look around.
And then I'd like to follow up, and then I left off on something about creating habits. Love is a habit, but so is gratitude. I try to channel gratitude, and that I think Dr. Watkins touched upon that. Grateful to be on the front lines, to be a doctor, to be able to help and do something in a time of crisis, to be actually can be counted on, and to matter, to have purpose, and then to have that gratitude gives me hope that there is still work to be done. And I've noticed that when I travel elsewhere, I love everyone's around outside of the United States love to shit on Americans. Oh, you're American. When I rock up at a hostel, it's like, here come the American jokes. Sometimes I'm like, I'm a New Yorker first and then an American. United States of New York. And but I realized that there's some kind of, I know we had like said in somewhat jest that we get away with it, but there's also this ideal that somehow, despite all our faults, we've always created progress. Like it just kept progressing. Maybe in an oscillating way that's going this way up, but lots of ups and downs. But there is always room for improvement. Where when I go to other countries, like, well, if I protested, they'll just jail me and kill me. And I was like, well, that happens in our country. It's like, but yeah, but like they really don't want progress. Whereas you always have had things that were better than 10 years before, 20 years before. And I don't understand how Americans just get away with that, because it seems like you're on the outs, and somehow like things like Georgia happens, that, Stacey Abrams flips it blue, or, Biden gets reelected, or, obviously I'm showing my political bias here, what counts as progress, but I definitely think there is a trajectory that we are all part of, that there is a right and wrong of history. And we've always been there have been people who've always cited the right side of history. However, it's that, how do we sustain that hope? Channel gratitude. So that's the only way to like stay in the fight. Like, oh my God, like I'm grateful to still be alive, and even grateful for that. That's that's actually a form of activism, I think. Is it a radical self-care is radical, staying alive is radical in this world, and I think it's great. I'll take whatever I can get, and then build upon that as a foundation to then keep pushing for more progress. Until I'm no longer around, I'm gonna, as long as I exist, is a form of activism, a form of defiance, given the communities that I represent and communities that can influence. And as long as I push towards that trajectory, that can sustain hope. But the moment we just give up, or not give up, but just get lazy, get entitled, be prideful, oh, everything's great. Oh, they don't need my help. Oh, everything's one hunky-dory. That's when we lose. And that's when complacency overrides everything. That's when we lose progress and lose hope.
I would just add that the forward progress is a lot of work. It's not just happening. It without a lot of work and a lot of organizing and a lot of blood, sweat, and tears, this country wouldn't be anywhere. This country would still own people. This country women would not be able to vote. Like, and that is the truth. And it's a gratefulness for the people who've been out there for hundreds of years pushing for this forward progress, and that legacy that continues to this day, and being great and showing our gratitude to these people in these communities through the work that we do and the way that we do the work. And it kind of circles right back, right, to what are we doing and how are we living to show that gratitude that we live in this country where we see some of these things are possible. How are we honoring and being grateful for the people who are out there risking their lives, you know? And I think it's that. And I mean, it's like, it's all about the work. It's love. What is the work of love? What is the work of equity? What is the work of fairness? What is the work of integrity? Like, what is the work? And it's like we all have a place in it, and we all have work to do. Clearly, we all have work to do. So I just wanted to just highlight that, it's a lot. There are people doing it because trust me.
And I always say that gratitude. I forgot to say it. It's like I'm grateful to be alive, or the fact that we have the Zoom call, the fact that everyone here, going to Yale, or that I'm a doctor, is because somebody died so that I can be here right now. Somebody died. Somebody out there, generations before, fought with blood, sweat, and tears, but literal lives to lay down their lives so that I can be speaking in front of you right now on a Zoom call with other fellow people who are also here because of some other sacrifice other people may have made. And really, the spotlight is on us. Don't look around for someone else to do it. It's on you to be part of that. And some of us may make it through, some of us may not, but that doesn't matter as long as we are pushing constantly, because otherwise I'd rather live than just exist.
Well, these are, I feel really grateful to be able to have been a part of this conversation, and I have so much to think about. I think we all have a lot to think about, and this group, SHEA, has been just doing amazing work to help push these conversations on Yale's campus in a lot of different directions. And so I look forward to continuing to be in conversation with all of you, and feel really appreciative of the hard truths that were dropped today.
Yes, exactly. Thank you. Yes, thank you, Dr. Sun, Dr. Watkins, Professor Radin, just for everything that you said. I'm sure that everyone who's been listening has a lot to kind of think about, contemplate, remember, take away from this talk. So thank you for engaging with us, joining us today. We hope that we're very excited just to see what you guys as doctors and as professors get to help enact change that we'll get to see in a few years. And hopefully we can be a part of that as well. So our last thing, Sonia is going to talk to us a little bit about a conversation that we're having next week about equitable vaccine distribution, which we touched on a little bit today. So Sonia, it's all you.
Yeah, thank you again to all of the wonderful speakers today, and to Ngozi and Ama for organizing this discussion. It was great, a lot to think about. I just wanted to plug the second part of this SHEA workshop series happening next week at 5 p.m. on Thursday, March 25th, with doctors Jason Schwartz, Saad B. Omer, and Ruth R. Faden, and it's on global COVID-19 vaccine equity. We'd love to all see you there and continue this discussion in regards to equitable distribution of the COVID-19 vaccine. So, yeah.
And there's a Facebook event for that on our SHEA website, and the recording of this talk will be up on our YouTube account as well. hopefully within a few days, we shall see. Yeah, but thank you all for joining us. Again, Dr. Sun, Dr. Watkins, Professor Radin, thank you for having this very important conversation. Yeah, that was all. Thanks, guys.